Good evening, and thank you for joining tonight's community conversation hosted by the City and County of Broomfield. My name's Roger, and I'll be your moderator this evening. Presenters tonight include Mayor Pat Quinn, Mayor Pro Tem Guylene Castriata, Councilmember Kim Groom, City and County Manager Jennifer Hoffman, Police Chief Gary Krieger, and Public Health Director Jason Balling, along with Broomfield staff who will be available to answer your questions. Before we begin, I want to take a moment to tell you about the format for tonight's interactive call. We realize some may just want to listen, and that's perfectly fine. But for those who would like to ask a question, we please encourage you to press *3 on your telephone. You will then be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until you are called upon. So go ahead and press *3 now if you already know your question, and we'll follow the same process throughout the call tonight. If you hear something that generates a question, just press *3. We want to hear from as many of you as possible, so we'll limit callers to 3 minutes to ask their question. When it's your turn, I'll call your name and ask you to repeat it for our live audience. Also a note for panelists and community members asking questions, please speak slowly and clearly tonight, as this year's telephone town hall are being translated and streamed live in Spanish. If you'd like to listen in Spanish or ask your question to our moderators in Spanish to translate for everyone, please call 855-543-3424. Now I'd like to turn it over to Mayor Quinn for some brief opening remarks. Mayor, good evening.
Thank you, Roger. Good evening, everyone. This is Pat Quinn, Mayor of Broomfield. Thank you for joining us tonight. But before we get started, I'd like to take a moment to send our heartfelt condolences to the 10 victims, their loved ones, the Boulder Police Department, and the entire Boulder community after the senseless violence Monday afternoon at the King Soopers. This devastating tragedy comes on the heels of the shooting in Atlanta. In Colorado, we've experienced far too many mass shootings, Columbine, Aurora, but this one feels and is too close to home. All of us have some strong connection to Boulder. I could not believe the number of Facebook posts from my friends that said they were friends with one of the victims. So tonight we grieve. With that thought, we would like to invite you to join us in a moment of silence to honor all of the victims who lost their lives way too soon, and for their families and loved ones left to pick up the pieces. Thank you. All of us at the City and County of Broomfield and the Broomfield Police Department will continue to support Boulder's efforts to bring justice, and will insist in whatever capacity is needed during this devastating time. On the call tonight, you will hear a lot of resources, websites, and phone numbers, so please grab a pen and paper if you don't have one nearby. You can also find a list of all the resources mentioned tonight at broomfield.org. Again, that's broomfield.org. Now, before we start your questions, I will turn it over to Mayor Pro Tem Guylene Castriata. Guylene?
Thank you very much, Mayor. This is Mayor Pro Tem Guylene Castriata. We are all deeply saddened by Monday's shooting in Boulder and the cumulative impacts that these senseless acts of violence have on all of our lives. We encourage you to support your mental health during this difficult time. I'm going to list some resources now. If you'd like to grab your pen and paper, we'll also show it on the screen for those of you watching tonight. Mental health partners who are on the call tonight and serve Broomfield and Boulder quickly organized a response to this event to provide resources and information on trauma response, mental health, and how to talk to children about an act of mass violence. Resources and a link for their hosted town hall happening tomorrow at noon can be found at mhpcolorado.org/community-in-morning. Again, that's mhpcolorado.org/community-in-morning. State and local resources can also be found at broomfield.org/mental health. You can also call 844-493-8255 or text TALK to 38255. Again, that's broomfield.org/mental health. And the phone number is 844-493-8255, or you can text TALK to 38255. This week also marks the 1-year anniversary of the COVID-19 pandemic in our community, which has taken the lives of 74 Broomfield residents who will not be forgotten. Please continue staying diligent to the end to end this pandemic by getting the vaccine when you're eligible and waiting on gatherings, wearing a mask, washing your hands, and watching your distance. It will take all of us coming together as a community to get through this once and for all. Now I'd like to turn it over to my colleague, Councilmember Groom. Kim? Councilmember Groom, I think you're muted.
Okay, thank you. Hello, everyone, and thanks for being with us tonight. I am City Council Member Kimberly Groom. I'd like to echo my colleagues' condolences for the families and the victims killed in the Boulder and Atlantic, Georgia shootings. I'm so proud of our police department for the quick and compassionate response to the Boulder police when they were called for backup. While we can't make sense of this tragedy, we can come together as a community to love those around us and remember the lives and honor the legacies of those who had fallen and left us way too soon. The Broomfield VOAD, the Voluntary Organizations Active in Disaster, is a member with partners that have extensive resources available during crisis. Please make sure you use these resources that have caring listeners, meal preparation, counseling, and much more. If you or someone you know that is in need of these resources, please reach out and contact them at Broomfield, V as in victory, OAD as in day, at gmail.com. Now I'd like to turn it over to our City and County Manager, Jennifer Hoffman. Jennifer?
Good evening, everyone, and thanks for being with us again tonight on a pretty somber evening. And thank you, Councilmember Groom, Mayor Pro Tem Castriata, and Mayor Quinn for those thoughtful remarks. We echo those on staff and throughout this community. Our hearts are aching across this community for our neighbors in Boulder, especially for all of the families and loved ones of the victims that were so senselessly taken. The police chief, our public health director, and Susan Bellis from the Mental Health Partners, along with many more staff, are here for you all this evening to field any questions that you may have and or take any comments. And we just want to, again, take the time to be there for all of you as a community. And what we've been through this week and been through this year is so significant. It will no doubt leave a lingering impact for all of us for years to come and for the rest of our lives. But we remain resolute that we believe that we can get through this together by coming together, leaning on each other during these difficult times, being vulnerable, seeking assistance, and again, showing supreme act of love and kindness every day and throughout the day. We are consistently reminded of perspective. While we're eager to hear from all of you, I do want to introduce our police chief, Gary Krieger, who's going to say a few words. Chief?
Thanks, Jen, and good evening, everybody. The Broomfield Police Department, the entire City and County of Broomfield family, and the Broomfield community is deeply saddened by the events that unfolded in Boulder earlier this week. 10 innocent people, including Boulder police officer Eric Calley, lost their lives in a senseless act of violence. Now 10 families, the Boulder Police Department, and the entire Boulder community is left to grieve and try to make sense out of what happened. And our heart goes out to all of them. I'm proud of my officers who responded to the scene without hesitation. In total, 29 Broomfield police officers responded and assisted the Boulder Police Department. And we have committed to continuing to assist Boulder as long as we are needed. While we are eager to hear from you very shortly, I do want to introduce Public Health Director Jason Balling to give us a quick COVID update. Jason?
Thanks, Chief. And we really do appreciate you and Broomfield PD. Good evening, everyone, and thanks for joining us. I'm Jason Balling, the Director of Public Health. As stated before me, our hearts are with the people of Boulder tonight. And for years to come, this trauma will have a lasting impact on all of us. I encourage you to reach out to someone to talk, whether it's a friend or one of the mental health resources available to you. You're not expected to process this alone. I'll repeat where you can find those resources. State and local resources can be found at broomfield.org/mental health. You can also call 844-493-8255 or text TALK to 38255. Now for a quick COVID update. Thanks to you all, Broomfield is doing a great job getting the vaccine, with nearly 13,000 residents now fully vaccinated. I'm also proud to announce that Broomfield Public Health will start weekly vaccination clinics at the First Bank Center, starting next week on March 30th. You can sign up for appointments when you're eligible, starting March 25th through broomfield.org/COVID vaccine. Again, that's broomfield.org/COVID vaccine. You can also now sign up for text alerts by sending the letters CCOB to 994-11. And as always, please look for available appointments through your pharmacies and medical providers. While this is great news, we should remember that COVID variants present in our community are still a concern, in part because of how rapidly they spread. Variants, coupled with the state announcing the less restrictive Dial 3.0 this week, means it's important we continue to wear a mask, keep 6 feet of physical distance, wash our hands, and avoid large gatherings. On behalf of all of us, we look forward to your questions and thank you for continuing to call in. Roger, back to you.
All right, thank you, Jason. I was looking at the calendar. We started these calls on the 19th of March a year ago. It's hard to believe. We're going to go to your questions now. If you'd like to participate and ask a question, press *3 on your telephone. You'll be transferred to an operator who will take down some basic information and get you in the queue. So again, as a reminder, *3 if you'd like to ask a question tonight. And we're going to go and hear from Steve first. Steve, go ahead.
Yes, I had a two-part question. One was last year there was a lot of talk regarding defunding the police. And so my first question is, actually, has there been a reduction in the police department budget? And then the second part is, what is the mayor and the city council doing to better protect our police department? And I would like an answer better than just riding around in a cop car with them. Thank you.
Steve, thank you for your question. The budget for the police department has not been cut at all, and in fact, the city council is supporting and working very hard with the police chief and the city manager to increase the staffing within the police department, because we've recognized over the years that we've lost a number we're growing as a city, and we want to make sure we replace the police officers that are gone, and we want to increase the police department. So there is 100% support on city council. We support their budget. We support their activities. We're very proud of the fact that our city has been a leader in recognizing that many of the people that we respond to on police calls have mental health issues. We have partnerships with mental health partners and others. And so this police department has the complete support of the city council and me as mayor. And we're giving them the resources they need, both to make sure that we're safe and to make sure that we respond appropriately to the nature of the call, and the issues that the officers face when they meet mentally ill people. Thank you.
All right, Sean is next. Go right ahead.
Hey, how's it going? Thank you, Mayor Quinn. These calls have provided me great solace in these troublesome times. It's often these people that are pro-police and pro-guns. I don't know, these two issues are fighting against each other. What are you doing to change the gun laws in our county? Is the NRA in your pocket?
Hi, Sean. It's Gary Krieger. I'm sorry if I interrupted you on your question. So let me try and answer, and maybe one of the city and county attorneys would like to add to it. Under Colorado law, gun laws are the sole responsibility of the state of Colorado in conjunction with the federal government. And so those are usually generated either through the Congress at the federal level or through the legislature at the state level.
All right, let's go to John next. John, go ahead.
Yes, thank you. My wife is 75 years old and she's an invalid, so she's not able to get out to get a COVID shot. I understand that Denver and a couple of other counties are starting to have an in-home program. Does Broomfield have any plans for that? Thank you.
This is Deb. I'm in the Public Health Department, and thanks so much for asking that question. We have done a lot of outreach in older adult communities and held clinics on site in apartment complexes and residential areas where we know mobility is an issue. But your question is a really good one, because there are individuals that are in homes and may still be trying to access the vaccine. So if you could send us an email, John, at publichealth@broomfield.org. To answer your question, we are working with local healthcare and home health providers to try to coordinate. And so I think that the best for your individual situation would be if you could contact us, again, publichealth@broomfield.org, and we'll find out a little bit more about your situation. But we are trying to make sure that everyone who wants the vaccine has the opportunity. So we do need to hear about these situations and make sure that we can coordinate access. So thanks for bringing that up.
Okay, we lost you there at the end. Again, as a reminder, if you'd like to ask a question of our panel, please press *3. Susan, it's your turn. Go ahead.
Yeah, hi. This may be something I need to address with King Soopers, but I don't know. I was in the King Soopers at 120th and Sheridan today, and two ladies were walking around without masks, and I went up to a supervisor at the self-checkout, and I told her, and she says, well, we can offer, but we can't make them. And I said, well, you've got on there that it's mandated, so why would they be allowed to be in the store without it? She goes, well, that's all I can do. And I'm like, why is it that some enforce it and some don't? I thought it was an enforcement here in Broomfield.
Yeah, Susan, this is Deb, and I heard there might be some issues with my sound, so I'll try to answer, and if you're having troubles hearing me, I'll call back in. But Thanks for raising that question. And you're correct. There still is an indoor face covering requirement that is in effect in Colorado and that we're enforcing here in Broomfield. There are a few situations where people are exempt, like for instance, if they have a medical condition, but any business can deny entry to individuals that are not complying with the face covering requirement if they're able to provide reasonable accommodations. So in this case, to arrange for curbside pickup or ordering things online. That being said, we know it's a difficult position for businesses to have their staff. Sometimes it feels confrontational. And so we are working with local businesses, providing support and education to help them with these interactions. So certainly we can follow up with this particular business and try to support them, but they do have the ability to deny access if they can provide those reasonable accommodations. But I do think it is a challenging situation, and we certainly don't want anyone to be put in a situation where they don't feel safe, but there are ways that we can support them in having those conversations, and we'll continue to do that. Thank you.
All right, let's go to Chris next. Go ahead. Chris, you're live with our audience. Go right ahead.
Okay, can you hear me now?
Yes, we can.
I can. Okay, thank you for taking my question. My question in the whole scheme of things tonight and in your introduction seems rather inconsequential, and I do want to reach out and say thank you to all the Broomfield officers that did assist in Boulder, but I will ask my question because I have it written down. So my understanding is that a high percentage of Broomfield residents who are 65 and older have been vaccinated. Recently, 50 and older are also getting their vaccine. I live in a senior community. Are our residents still considered high risk or not?
Thanks, Chris, for that question. And it is an excellent question. As you mentioned, we're doing extremely well in Broomfield in vaccinating our older adult population. I think the important thing to remember is, has our older adult population been fully vaccinated? That means if they're either receiving the Moderna or the Pfizer vaccine, they've received both doses and have waited that 2 weeks for full immunity to build up. Or if they've received the Johnson & Johnson vaccine, they've received it and waited for that immunity to build up as well. So while we're doing great with our 70 plus and getting them fully vaccinated, we know we still have room to go with our 50 to 70-year-olds to get there. What CDPHE is recommending in the meantime is, given we're in level yellow, is just for our older adults to be cautious, and if you're out traveling and you haven't been fully vaccinated, continue to follow those 4 W's. The other thing that CDC has recently announced is if you are fully vaccinated, it's okay to be in another household or in the same household with another set of residents or family members that are also fully vaccinated. So I hope that helps to answer your question, and thanks.
Thank you. Let's go to Wesley next with a question. Go ahead.
Hi, yes. Thank you. I recognize the somber tone at the beginning of the call, and I respect that. My question is about the COVID vaccine rollout. In particular, today was what the launch or release for appointments for the First Bank Center. And I was on the website at 3 p.m. I followed the instructions that said use the zip code 80021. 80021 yielded no results on the King Soopers website. I have no idea why you're using that website, but I was unable to get my wife, who qualifies in Group 1B4, an appointment because it never yielded any results with that area code. So I want to know, zip code. I want to know, one, why the rollout of that was so poorly done, And 2, when the next release for vaccine scheduling at First Bank Center is going to be. Thank you.
Hi, Wesley. This is Deb in Public Health. I'm sorry that you had a frustrating experience, and I will absolutely acknowledge that this afternoon there was a surge of individuals trying to make appointments at the same time. So we do know that, literally hundreds and possibly thousands of people going at the same time does prevent difficulties. And so there were a few minutes when the King Super site was down, but it was immediately back up. And I think the reality that we're finding, not just with this event, but as different vaccine opportunities become available, is that they tend to fill up extremely quickly. And so we are discussing if there are additional ways that we can streamline the process for signing up, because obviously, as you know, there are a number of steps that you need to take. But right now, we're in a situation in Colorado and here in Broomfield where the supply is much less than the demand. And so each week we will continue to have opportunities, not only with the First Bank Center, but we are continuing our partnership with the Thornton Fire Department, and there will be opportunities for additional signups next week. On that website, broomfield.org/COVID vaccine. We're also really trying to remind people that we are doing our best to get vaccine out in Broomfield just as soon as we receive allocations from the state, but there's also a number of other providers in or around Broomfield that you can sign up, and you can get to those sites from our website as well, broomfield.org/COVID vaccine. So that includes pharmacies, healthcare providers, and we expect as we head into April, again, I know it's been frustrating when you're waiting and you're ready, but more sites and opportunities will come up as the supply increases heading into April. And so again, our website will continue to be a good hub for that. So encourage you to try again in next week. And we will continue to keep posting information and new opportunities as they become available. But today was really a challenge, just a lot of people trying to get on the site at the same time. And unfortunately, that did pose some difficulties. So thanks for letting us address the question. Appreciate it.
Deb, for those of you who joined the call late, good evening. I'm Roger, your moderator tonight for this interactive community conversation hosted by the City and County of Broomfield, Mayor Quinn, Mayor Pro Tem Castriota, and Councilmember Groom. If you'd like to ask a question, please press *3 on your phone and you will be transferred to an operator who will take down some basic information and get you in the queue. I'll also mention we have about 30 minutes left. If you don't want to speak to the operator or need to leave the call early, you can leave a voice message by pressing *9. So again, *3 if you'd like to ask a question live with our panel, or press *3 for a question live and *9 to leave the call and leave a voice message. Let's hear from Robin next. Go right ahead.
Thank you for allowing me to ask the question. It was the caller before me asked the exact question that I was concerned about. I had logged on to the website right at 3. I tried intermittently throughout 2.5 hours, still couldn't get anything to come up for King Supers. It just said that they were out of vaccine. I've had that same experience with Thornton Fire. I've had that same experience with SCL Health. So I think it was answered that you're doing the best you can. It's just unfortunate that I don't know how all these other people got vaccinated, but congratulations. I'm happy for them. I just was trying to find out this afternoon if what I was doing was incorrect, but 2 other callers have already asked the question. So thank you very much.
Yeah, Robin, I appreciate, this is Deb in Public Health again. And again, I appreciate that it's been frustrating, and just want to reiterate that everyone will get their turn. I know that doesn't help when you're ready now, but just want to reiterate that we will continue to make vaccines available to everyone that wants to receive it. It just will take us several more weeks and months to get through everyone. So I appreciate that your willingness to receive the vaccine, and I do anticipate that the process will become less competitive in the weeks ahead as more opportunities become available. So thanks again for your comments.
Okay, it's Lori's turn next. Lori, go ahead.
Hi. First of all, I wanted to offer my condolences to anybody affected personally by the events in Boulder. I really just don't have the right words, but I feel very bad about it. I'm so sorry. What I called for is several weeks ago, I got my first vaccine at City of Broomfield Health and Human Services building. I was lucky to get an appointment, and I just wanted to call and let everybody know what a great job I thought they did. They were really organized. I felt they did a great job keeping us socially distant. I was nervous about going, but I felt really secure being there the whole time, and am very happy to have one shot under my belt. So thank you very much for doing that.
All right, thank you, Lori. Let's go next to Dana. Dana, go ahead.
Oh, thanks for taking my question. I actually have two questions. I hate to hog up the time. My first question is at the beginning of the call, I heard how many people have been vaccinated. I also heard how many people had died, unfortunately. Often in the news, I hear about how many people have contracted the virus. The one number I never hear is how many people have recovered. Specifically in Broomfield, it was a little over 13,000 that have been vaccinated. How many people have recovered? Because that must impact, how the potential for it continuing to spread. That's my first question. My second question is I'm an employer here in Broomfield, and three of my best friends are also have businesses here in Broomfield. One of them is one of the largest employers here in Broomfield. All four of us are struggling due to COVID with finding employees. Between us, we could hire anywhere from 300 to 500 people today. And I'm wondering, is there anything that the city or us as businesses can do? Because people, they just don't want to apply and they just don't want to work. So those are my two questions is how many people have recovered and what can we do to actually employ people, because people just, due to COVID, don't want to work.
Hi, Dana. It's Deb in Public Health. I'm going to start with your first question, and then I'll hand it off for your second question. And so it's difficult in terms of recovery, because we know that some people do continue to experience lingering symptoms of COVID, even after weeks and months after contracting the virus. So I'm not going to be able to give you I don't think the recovery data exactly as you're looking for, but what I can say is that to date, there's been 4,112 cases of COVID amongst Broomfield residents. And of those, 199 have been hospitalized and 74, as you heard earlier, unfortunately died as a result of COVID. And so it has had an impact on our community. We know there's cases that go undetected, but certainly we are trying to keep our data transparent. It's on our website, and I appreciate you asking the question. So I'm going to turn it over to City Manager Hoffman to address the second part of your question. Thank you.
Thanks, Deb. I sure appreciate it. And actually, I'm going to have our economic vitality economist, Jeff Romine, answer the question with regards to workforce availability and what we can do in order to assist filling some of those positions. Dana? Jeff?
Yes. And again, I'm Jeff Romine. And If you wouldn't mind doing this, if you would send me a quick email, just so I can get your contact information. My email address is jromine@broomfield.com. What I'm going to do is we've heard this concern from several businesses that it's difficult to access and find really good employees just because of the uncertainty in the economy and how people are unsure whether they want to return to work. We're trying to encourage people. My colleagues over in the workforce, in Broomfield's Workforce Center, are there already, and they've been working with businesses and working with people who are seeking employment. And they have a number of programs already in place that businesses can hire people that are looking and perhaps do that in a way that benefits and increases skills for those new employees. And so it's an opportunity to both train, find really motivated workers. And so I'll put you in contact with my colleague Chris and his team over at the Workforce Center. And then also that way we can engage in other things that we can do to help you, your business continue to grow and sustain in our community. And happy to talk with your other friends, business owners that are also having these same kinds of problems. So again, my name is Jeff and my email address is jromine@broomfield.org. Thank you and have a great week.
Thank you, Jeff. Let's go to Jennifer next with a question. Go ahead.
Hello, am I up?
No. You are. Go ahead, Jennifer.
Oh, hi. Yes, thank you. So I'm looking for some help, but I'm really concerned about our students. I mean, their emotional health in this time. I can't imagine what it feels like to be a student right now and miss your graduation, your prom, your homecoming. My heart is breaking for these students, and that's not even the little ones that cry when they find out they can't come back and see their friends at school. There are so many emotional things going on with them and psychological things. Their support systems have been taken away. And but I need help talking to my teenage daughters about the changing narratives with COVID-19. And I don't know how to address their skeptical questions about the mask and why it's supposed to work, and they don't believe me. When they see arbitrary COVID rules, you walk in with a mask into a restaurant, but you take it off to eat and then put it on to go to the restroom. You stand 6 feet away in line to get on an airplane. We're crammed in together, and they're smart boys and girls. Our kids are smart, and so the schools they go to gives them mask breaks, and they go outside and they take their mask off. Then they hear President Biden say and Dr. Fauci say to wear the mask, especially outside. And they've traveled over the holidays in the airplanes, and they see this and they bring it to me. And they're social distancing at the airport, but they're on a 5-hour flight crammed in. And then they come to me, and I don't know how to get them to believe me. And I don't know what to tell them.
So Jennifer, this is Susan Bellis at Mental Health Partners. So maybe I can answer part of it. I agree. I think there is a higher risk factor in the last year for our students. And I am thankful that we are getting back to a little bit more normalcy and trying to balance the risk for health and also the risk for mental health. And just having our students back in the classroom, I'm thankful for this happening after our spring breaks now. And I think the support they receive through the classroom, through their teachers, through the counselors at school, through social emotional learning is super helpful. And I can't help but appreciate teenagers are the best. I mean, they just see things so clearly and they just call us on it. So I think it is interesting, for them to try and balance. And as a parent, you're struggling to try and do both things, but to say have them do the research, okay, give me both sides of the story. Let's argue it. And then let's flip the coin. Now let's argue it the other way, because then they're going to learn more and they're also learning how to make decisions. And personally, even through this whole time, it's like, I keep thinking like every family is making their own choices about what they feel comfortable with and their level of safety. Like, what are they doing? What are they limiting, from being completely isolated and wiping things down in your own household to, some people being outside. So, I'm also trying to respect people using their own brain to make the right decision for them and their own health. But I might turn it over to public health, because I don't know if they have any other advice as you are trying to help your young adults, figure this out and hopefully make healthy choices.
Thanks, Susan. And that was a great response. And I too have teenagers and a college student and a public health director. I get these questions as well. And first of all, we all know how difficult this year has been for our kids and teenagers and everybody. I don't think there's anybody that would deny that, especially when it comes to mental health. Regarding where we're going, we're at a place where we're vaccinating quickly and we're not seeing significantly high hospitalizations. So we're expecting to hear more about guidance for graduation, guidance for proms, more of getting back to that normal for our teenagers and for our kids. A couple other things I think that's important is the science around how COVID spreads has evolved pretty much on a weekly basis from when we first started this in March. It was a novel virus, the wild strain, and then we've had multiple strains that continue to evolve in our society and in the world. And so we know we have to continually look at what's from epidemiology, the transmission rates, and based on that, that's where the recommendations come from. I do also understand that there is some inconsistencies between removing a mask in a restaurant versus being in a school and wearing masks. One thing we have seen though is masks, along with doing the other 3 W's, are some of the most important interventions, and specifically in the school setting, it's a multi-layered approach. And when we see that occurring, we're able to reduce school transmission to extremely low levels. So I would say masks, from every research that I've looked at and all of the leading public health experts, are one of the most effective interventions we've had throughout this entire pandemic. And I do appreciate your question, and please give my best to your teenagers.
Thank you, Jason. Again, if you'd like to ask our panel a question, press *3 on your telephone. Jennifer and Kathy are standing by. They'll get you in the queue right away. We've got 15 minutes. You've got plenty of time to get your question answered. Christopher is next. Let's hear from him. Go ahead.
Hi there, folks. I just wanted to say condolences to my neighbors. Obviously, the recent shooting at Table Mesa has affected our community in a way that words can't exactly describe. With that being said, I wanted to also say thank you to the service from our Boulder police officers, as well as the Greater Front Range police officers. With that being said, I did want to ask the question of, with regard to the sentiments that some citizens may have in the community to the defund the police, I wanted to ask, what is the county doing with regards to mental health funding, not only inside the police department, but also outside the police department? What are we doing are we doing anything within our public health department? And how does that bleed down to education, as we do know that many kids are ostracized and put into poor mental health positions with regard to not only education, but also the onslaught of the pandemic? Thank you very much.
Thank you for the question, Christopher. This is Mayor Pro Tem Guyleen Castriata. I am really pleased to say that Broomfield has had a mental health co-responder program in place for the last 3 years. And additionally, this city council has made mental health, developing a strategic mental health plan as one of our council priorities. And we have certain benchmarks we are meeting in each quarter. We're having coordinated suicide prevention trainings for our employees and setting up advisory groups, steering committees. We're convening our Communities That Care Coalition to discuss overall progress. We're developing a funding proposal for youth mentorship program, Sources of Strength webinar for parents through our Youth for Youth and Adams 12 partnership. We also have staff mental health training, and we're getting ready to launch some new initiatives. There's recently been some legislation established to establish a single agency that leads, promotes, and administers our state behavioral health priorities. And we've prioritized the Communities That Care Youth Development Program, which helps with substance use prevention. It's an evidence-based process that helps prevent problems before they start, and they aim to address the underlying causes of youth health and behavioral problems. We also have our Community Health Improvement Plan, also known as CHIP, with the goal of changing the narrative and building understanding of mental health as a positive state of well-being that the community builds and maintains together. We're working hard to reduce the stigma so that more people can get through the barriers to getting help. And I thank you for that thoughtful question.
All right, let's hear from Scott next. Go ahead.
All right, wonderful. Well, first of all, thank you for taking my question. Deb, to you and the rest of the Department of Health, thank you for your continued efforts. I'm sure it's been a very difficult and challenging year for you. I'm afraid my question is a little more selfish. I'm in the 50 to 59 with no complications group and have tried a couple of times. I've at least dipped my toe in the pool of trying to register and set an appointment for the vaccination and have ran into nothing but brick walls. So I'm curious to know if there's anything beyond perseverance and a touch of luck that can facilitate my quest.
Scott, this is Deb. Thanks for your question and your comments. And we are working really hard to make opportunities available to those that are in the eligible population, like yourself. As we've shared previously, we tried to streamline opportunities to one place through our website, broomfield.org/COVID vaccine. That said, the way the distribution is happening in Colorado, there is no one centralized place where a vaccine is going, and unfortunately that requires going to different sites, different providers to register. And I know that's not ideal, and I just want you to know we hear and we understand the frustration in public health. We're frustrated. We want to protect our community, and it's hard for us to not be able to get sufficient supply of vaccine to be able to get it out the door as quickly as we all would like. But we do anticipate more vaccine coming to Colorado in the weeks ahead, and that will then come down through all these different provider channels. So I do think that perseverance is definitely part of it. Patience is going to be part of it as well. And in the weeks ahead, we really do think we'll be able to get to everyone that is eligible and interested in receiving the vaccine. If websites aren't, going there regularly, one thing that you can also do, Jason mentioned earlier, is sign up for text alerts. And that can also just kind of help time in terms of when's a good time to check the website. And so you can get on our text alert list by typing CCOB, as in City and County of Broomfield. So text CCOB to 994-11. And thank you again for your comments and your patience. And I do think you will certainly get your chance in the weeks ahead. Thanks for the call.
All right, let's hear from Rick next. Go ahead.
Hi, thank you for allowing me to call in. I got some information from the Colorado Department of Health, and last year we had 553 people that expired in Broomfield. That was an increase of 123 from the prior year, which is a significant increase. 70 of those were related to COVID. Another 53 were need to be looked into why we had that increase, but I suspect it's due to some collateral ill effects from the COVID lockdown. I'd like to ask one quick question, two questions. One is, my wife and I are avid bicyclists and hikers around Broomfield. We've been doing that for since March, and we never wear masks, and there's no data to wear masks, and I don't understand why people are told to wear masks when they're outdoors. I can certainly see why they should wear some mask indoors, and I comply with that. So why do we not state very clearly that masks haven't been shown to be effective outdoors? Number two is the person called up about COVID and the school situation. Going back to 2018, there were 434 flu deaths in the United States for people 17 and under. We've had 238 COVID deaths in the United States. We're not going to shut down school if we have a flu epidemic next year, I hope. So it doesn't seem to me to make a lot of rational sense. I looked at the mortality rate, which, no one wants to look at that stuff. It's just anyone passing away. But the risk of getting COVID for your infection mortality rate is 1 to 30,000 to 1 to 50,000. So why are the schools even shut down in the first place? It doesn't make sense. If you could answer those two questions, I'd appreciate it.
Yeah. I appreciate your questions, Rick, and sounds like you've done quite a bit of research. We do know that across the nation that COVID is one of the leading causes of death this year, and that's commonly accepted in the medical and research community. Regarding masks, you're right. If you are out riding a bike and you're able to maintain that 6 feet social distancing, especially riding a bike when you don't have to worry about respiratory droplets going back and forth. Our current public health order that we're following is the state public health order that just requires masks indoors. It doesn't require masks outdoors. Now, certain people may feel more comfortable still wearing a mask outdoors if they feel they're vulnerable or in closer proximity to an individual. But the science is pretty clear that transmission primarily occurs indoors, especially when mask wearing is not occurring. And then your second question about schools is a good one, because yes, the severity of infection is much less among our school-age children. The problem is we see cases increase in our school-age children or young adult population, especially as we were dealing with this crisis early on and back in November. What we see is it leads to increased community transmission. And at that point, we didn't have vaccines, which then led to the potential for increased hospitalizations. We're in a different place right now. I keep saying there's hope. There's light at the end of the tunnel. We hope everybody gets that vaccine they need, and when their time comes up and does it. And we could get to that place of herd immunity. I feel like we'll start to get back to that place of normalcy as a community. So I can understand the questions and the frustration, but everything that we've been doing in Broomfield has been solely driven based on data and science. Thank you.
Thank you, Jason. Let's hear from Ken next. Go right ahead.
Okay, I have one observation from a couple callers ago. He was asking how he could get a vaccine, and I got my vaccine yesterday, and all I did was I started calling different pharmacies and different doctors' offices and having my name put on the list. As far as by the end of the day, a lot of people haven't showed up and they need to use those vaccines. I think more people need to try to do this. It's kind of like looking for a job. If more people would just get into doing that and doing some more research out there instead of just waiting for these fairs to happen, there's a lot of vaccines that seem to be wasted out there, and they could take advantage of those vaccines. The second thing I wanted to say was it seems to be all the people that are fighting the masks are also fighting getting the vaccine. They're waiting for everybody else to get the vaccine, but they don't think this vaccine is proven. Any of the vaccines are proven to work or to be safe, and they're all worried about different things instead of, what the basis is as far as people actually getting well, people actually protecting themselves. I think the paradigm has to change. And what are you guys doing as far as, working with these people that have their doubts and have their doubts about the vaccine, have their doubts about, the mask, have their doubts about everything, and they think it's basically a government-started, disease, and the numbers are extremely elevated due to that.
I'd be happy to take this question. This is Chris Urbina. I'm a physician and the medical officer for Broomfield. Great comments, Ken. I think we're all in this boat together. I think as an expert in COVID-19, I work with a lot of health professionals and public health workers who try to spread the information that's science-based, as Jason alluded to earlier, about the effectiveness of masks, physical distancing, of washing your hands, of avoiding large crowds. We know that those layers of protection are helpful in reducing the amount of spread of the infection. It's a respiratory infection. The greater distance, the more you can cover your face and other people are covering your faces. All of those are protective factors. Nothing is perfect in terms of preventing those infections, but we try to do our best, particularly in schools and our communities. And we're often repeating ourselves over and over again. Now, the vaccines are also extremely safe as well. As you know, their effectiveness, depending on the vaccine you look at, 94 to 95% effective at reducing the moderate to severe disease, hospitalizations, and death. Yes, you still can get an infection, but it's less likely. That data is still being studied. All these vaccines, including the Janssen vaccine and the soon-to-be AstraZeneca, are emergency use authorizations. So we're following these people over a period of time. We're likely to find out that they not only prevent moderate to severe disease, hospitalization, and death, but they also reduce the amount of infection in our community. So that combination of natural immunity, people who've had the infection before, vaccinations, and all the prevention strategies will reduce the amount of spread in our community. Now, that's as simple and as scientific as I can make this. Now, it's up to you and all of us to spread the information that's correct. Now, there are always going to be doubters, like the teenager that we talked about earlier. They're going to question, and I think that's right to question, but I think it's also right to seek information in science to answer your questions so you can make informed decisions about protecting yourself and others. So we're doing a lot of outreach. I just got off of a Spanish-speaking community forum of an hour ago to speak to our Spanish-speaking populations. We're doing these community forums to answer your questions. And hopefully as you learn something tonight, you can spread this information. We're all responsible. Our leadership has done a great job of doing that. We just need to continue to push helping people decide and get information that helps them make better decisions about reducing their risk and protecting themselves and their families.
All right, thank you. We'll take one more question from Christopher. Christopher, please be brief and go ahead.
Thank you. Real quick, I wanted to mention I got a vaccine recently at UC Health. They did a great job. I'm a leukemia survivor. I didn't get sick. Everything seems fine. But to anybody out there that's really eagerly looking for a vaccine, look up my Health Connection for UC Health. They probably will be able to help you. And then my question was had to do with is anybody on this panel have any specific information on where to receive mental health service, particularly for elderly. I have a few elderly folks under my watch that could use some assistance, and I just didn't even know where to turn.
Sure. Christopher, this is Susan Bellis at Mental Health Partners. So at Mental Health Partners in our Broomfield office, we do have one of our clinicians specializes in working with older adults and has many years of experience with that. Also, I think a second place is just to check at the Broomfield County Senior Services. I think they would also know other good providers in our community. And it does depend on, we take Medicare, we're more of a safety net provider. So if they have other insurances, it might be they just need to be checking with their insurance on who specializes in working with older adults.
Thank you, Susan. Well, we've come to the end of our community conversation tonight. Mayor, do you have some closing remarks?
I do, Roger. Thank you. On behalf of myself, Mayor Pro Tem Castriota, and Councilmember Groom, I want to thank all of you for participating in tonight's community forum. Our next regularly scheduled community conversation will be Thursday, April 22nd at 7 p.m. Residents are encouraged to engage with us by calling 855-695-3744 or watch through Channel 8 or via live streaming on Broomfield's website, broomfield.org. Thank you all for being with us tonight. Roger, back to you.
Mayor, thank you very much. And again, thank you everyone for joining us tonight. Stay healthy and take care of one another. Good night.